Hi, my name is Sue Sisley, and I'm a physician. I work in internal medicine and psychiatry, and most of my practice is actually telemedicine. So what you're seeing here is me in my telemedicine clinic where I see patients primarily far outside of Maricopa County, and I do primary care for seriously mentally ill patients. But one of my passions and one of my big academic pursuits is engaging in marijuana research, and I'm trying to do high-level, very scientifically rigorous marijuana research. And I'm so disappointed that I couldn't be there with you guys today. Our clinic is going to be at the Hopi Reservation all day today doing telemedicine outreach. But I'm so grateful to Kendrick for enabling me to share some of my comments with you over video, and I really look forward to meeting all of you eventually. I'm going to be serving as medical director for the Compassion First affiliated dispensaries, and for me that is a huge honor. I'm so grateful to be part of this organization and part of collaborating with such passionate people and working alongside of you in this movement. One of the areas that I am most focused on right now is eliminating the barriers to marijuana research. So as many of you know, there are tremendous obstacles at the federal level to advance marijuana research and enable it to be implemented. And I'll give you an example. Right here, I have a study that was approved by the FDA back in April of 2011, so over a year ago. This study actually the FDA has given our marijuana study drug an IND number. So it's a legitimate, high-level study that's scientifically rigorous, and it's sitting in limbo waiting for NIDA to approve it. Now NIDA is the National Institute on Drug Abuse, and it's a very absurd situation that NIDA has a government-enforced monopoly that insists that they are the only agency allowed to provide study drug for any FDA-approved marijuana trials. So this is why this study will potentially be derailed for years and years, because NIDA has no timeline to respond to a study like this. Once the FDA approves it, and remember the FDA is on a 30-day timetable, they're required to respond to any investigator-initiated studies within a month. But NIDA has no such timetable, so they can take 10 months or 10 years, and that can effectively shut down a study because they can simply refuse to sell the marijuana study drug to an investigator, and that would ensure that it never gets carried out. So the other example I want to give you here, this is our IRB application to the University of Arizona. So my position at the U of A is I'm an assistant professor, and one of my academic pursuits there is working on implementing high-level marijuana research. And IRB, Institutional Review Board, is a required hurdle that must be overcome. Anytime you're doing human subjects research, you have to go through this Human Subjects Protection Committee called the IRB. And it's a very onerous process, which it should be anytime we do research on human subjects. We certainly want to make sure that we're taking all the right steps and doing things as ethically as possible. This IRB application is in front of the University of Arizona right now, and I will be notifying you guys probably within the next few months if this gets approved. Then this will hopefully add further pressure to NIDA to enable us to get them to sell a study drug. Now the reason that we can't use dispensary marijuana for these studies is because any FDA approved trials that are legal, that are legally managed on the federal level, have to receive their marijuana from NIDA, from the cultivation centers at the University of Mississippi. So a lot of people ask us, why don't you just use the high quality cannabis from our own local dispensaries? And we'd love to, but unfortunately the legalities of doing marijuana research that's FDA approved requires we go through NIDA. Observational studies are definitely a possibility that we hope to pursue very aggressively. The challenge with these studies is they still require institutional review board approval. They still require a population that's willing to kind of come out of the shadows and declare that they're using this drug. So there's some hurdles to recruitment, but I think that would be a goal of mine as your medical director. I'm really eager to try to galvanize those studies and try to bring the science forward. I want Compassion First to be viewed as a champion of science at every level, and so I'm looking forward to taking the lead in that area and trying to help you guys to organize as many studies as we can do. One of the interesting things about our Prop 203 program in Arizona is that it's been managed efficiently enough that we've accumulated a very substantial surplus fund. So our Prop 203 fund now has almost $6 million that have accumulated as a result of selling ID cards to medically ill patients and as a result of the enormous licensing fees that dispensaries have had to pay. So what's happened is that money, that $6 million, is voter protected. So it is unable to be swept by the legislature. But Director Humble also feels that money cannot be used for anything related to research or cannabis education. And so that's a problem that I hope to overcome in the next year. We're enabling it to go through the same drug development process that we expect of any other FDA-approved medicine. So that would be the goal, that we would allow marijuana, whole plant medicine. I'm talking about receptor level research, because those guys, they have that in the bag. Big Pharma is fully behind those folks and pouring billions of dollars into that. So that's not an issue. But if we're talking about whole plant medicine and enabling people to have the freedom to examine whole plant cannabis as a treatment option for a variety of their illnesses, then we have to support research that is going to provide evidence-based medicine, right? That's kind of a key, it's a key phrase in healthcare these days, right? All physicians are striving to base their medical decisions, their recommendations to patients, to base it on evidence-based medicine. So if we don't have access to evidence-based medicine because we haven't pursued the kind of randomized controlled trials that are required to reach that level of authority amongst physicians and any prescribers, then we have lost out on an opportunity to mainstream marijuana to a point where it's going to be widely accepted. We don't want to have a program in Arizona where 90% of the recommendations are written by 5 or 6 doctors. That's not an optimal situation. We want an environment where all physicians, allopathic, osteopathic, naturopathic, and homeopathic, all recognize that this plant is loaded with medical value and we need to understand more about it. And until we to reach a situation where we have a patient who can go into their regular PCP and have them write them a certification because that PCP is confident that the research and the evidence-based medicine is there, that it does exist. Until we reach that day, we're going to continue to have a situation where only a small number of prescribers are willing to participate in our program, and that's not shouldn't be acceptable to us. We should be striving to bring everybody into the tent. It should be a big tent where all health professionals, including nurses and pharmacists and everyone, is acknowledging the fact that this plant has legitimate medical value, and not just value, but that we know what strains of cannabis work best for what illnesses. That can only be achieved through research. That we know what dosages work best for what patients and what illnesses. That we know what delivery method is the most optimal. Is it best to vaporize or use edibles in certain types of disease states? So that research must move forward, and that's why when dispensary owners are wondering why they should care about legitimate FDA-approved research, that I think it's clear that until we allow those trials to move forward, we are never going to gain the kind of widespread acceptance in the community that we desperately need.